Hey, so what's up, y'all? It's Rob Ransom. Back with my mom. I have been a little MIA. I was traveling a little bit. So the last couple of videos my mom actually did on her own. So, she don't need me. But anyway, I'm here. I asked some questions and see if we can get some different answers and some things that may help everyone. So first and foremost, we are just over a week out. Surgery was last when Tuesday, last Tuesday, and we are now Thursday of the following week. So we're 9 days out. And so first you can see my mom has on her brace. There was a gentleman that came by and he measured her for a brace, and so as soon as she came, was discharged from the hospital and everything, they put a brace on her, and she has liked it. She says it's comfortable. It makes her kind of sit up straight, and definitely makes her stand straight. I can tell you from seeing where she has been over the last probably year and a half or so, just with constantly going over and over and over and over again, bent over walking, she is definitely standing straight up. That's the first thing I noticed when I saw her when I got back into town. And I came by and she has her walker, but she's standing straight up. And we haven't seen that for a long time. Her shoulders are back. And part of that is probably the brace too. It kind of helps you to remember to stand straight up. But anyway, how do you feel, Mom?
I feel really good. I want to say great, but I will temper my response and say if anyone had told me 9 days ago that I would feel this well, I wouldn't have believed it. So I feel really, really good. I am not in excruciating pain like I thought I would be. I'm able to flex just a little bit. I'm not supposed to bend, lift, or twist. So that's hard not to do sometimes, but you're reminded that certain things you cannot do. But all in all, my pain level is probably lower than it has been forever, and I feel so much better. I didn't realize how how I didn't feel well before until now. So I feel so much better that I am inside. It feels like I feel sturdier. I've got a long way to go because my core muscles and my glutes, all of my major muscle groups, are weak because of having to use them in ways that they were not supposed to be used over the last year or so. And it's just that part of it. I can definitely say we rounded a corner with that. So I feel really good.
And I think it's also important too to say that my mom also suffers from muscular dystrophy, as we said in the first video that we did. So a lot of her musculature has been weakened from that over the years. So the back part was another part of that, a more advanced part of that, later in life part of that. But so that's kind of how we got to where we are now. We didn't do a lot of hospital videos. It was just the timing. We had to be there early, and I met my parents there. And actually, when I got there, my mom was already in surgery. My dad came out. Him and I sat in the waiting room waiting. Did speak to the doctor afterwards. It was about a 2.5 hour surgery, and the doctor was extremely pleased. Shout the doctor out. We definitely have to say his name.
Dr. Charles Miller, and he is in Richmond, Virginia, and he is wonderful. He walked me through this whole process. Probably would not have done it had it not been the confidence I had in him. And that is the other thing, too. When you're in the hospital, before you do the surgery, make sure that you have a surgeon that you really, really trust and that you like. I think that has made my whole experience so much better because everyone in the hospital respected him so much. I was able to get the best of a lot of things that may not have come my way, but I really felt like he was on the job. He was making sure that everything was done the way that it was supposed to be done. The nurses were wonderful, had no untoward anything come up that I would not have wanted to come up. I did miss my medication one night, and but that was quickly remedied. But other than just that one night, my pain level has not been, I'm going to say above a 7, because I have had pain worse than 7 just normally. So having gone through this, I know that that I'm not in as much pain. And it seems to be my pain is coming more from the incision site, the surgical site, and also the fact that my sciatic nerve kicked in just a little bit. But he gave me medicine before I left the hospital for that, so that has not been an issue to speak of. So everything has gone really, really well, and I feel better than I have in probably at least a year and a half. So being able to stand up straight is a new phenomenon. It's almost like your body has been trained to just bend over and give itself relief, and I haven't had to do that. So I haven't had a problem with anything that was noticeable.
And I think we said before the hospital was Johnson Willis, and they did a phenomenal job. They really took care of her. Dr. Miller came out, spoke to my dad and I. He was extremely pleased. He just kept saying, everything went as planned. He said it was a tangled ball of kind of mess when he went in to do the surgery. The nerves were all tangled up and everything was all kind of fused up, and so he had to really work at it. But he did a phenomenal job. So the medicines now. My mom doesn't do well with narcotics. What medicines are you taking?
I am taking right now. He sent me home with Dilaudid. Now that is a narcotic, but it is not like, for some reason, like the oxys.
Okay.
And so that's what I always have had a problem with in the past. They make me nauseous. I'm not allergic, but they just don't agree. So he sent me home with Dilaudid and dexamethasone, which is a steroid for the sciatic nerve. Other than that, it was not a lot of medications. I took gabapentin to start with, and I'm just saying these because a lot of people take the same type medications
For lots of
different things, and they help some people and they don't help all the time. But what I have been able to do is, between the Dilaudid and the dexamethasone, keep the pain to a minimum and not had any, nothing. Whenever I slept through, I shouldn't say skipped, I slept through one of my medications night before last, and yesterday morning it was a little tight and it was a little sore and it was a little, but as soon as I took the medicine and got in my system, about 30 minutes or so, it was better. So I have not had any pain that I didn't feel like I could deal with.
So we are actually sitting here now waiting for PT. They are on the way today to start the first training treatment. It was a young lady that came by 2 days ago, and she did an assessment. And now we're actually waiting for the gentleman to show up and do the exercises and walk through whatever that person is going to do. So while we were waiting, we just decided to shoot a quick little video for everyone and kind of let you know where she was. I think Mom is ready for PT. I think she's already feeling better. We have to go, we can plan some trips or something. So we got to get her up and moving around, as quickly as we can. So any other things you can think of that you want to share?
Some things that just since I got home last Friday and over the weekend and just up until now, actually, some observations I have on my own, things that I thought of in the hospital or thought of prior to surgery, that I really feel like now have come full circle, such as the equipment that you need and the help that you may need and preparing things. You do need certain pieces of equipment. Everybody's different, so no two people are going to need the same thing. But the things that have helped me probably the most are being able to go to the bathroom alone, and that is because of the bidet. I will say that again. I know a lot of people have experienced that, but that is something that really takes the pressure off when you can go alone. That and
she put a bidet on her toilet.
Yeah.
So that, So
that was very, very instrumental for me. That, and also you will need grabbers, and anything that you go to touch will invariably end up on the floor. And if it does, just forget about it. Let somebody get it. But you will need some grabbers to get things off the floor. You will need the walker I need that just to stabilize myself. I feel that the surgery, it almost feels like sistering two pieces of wood together in my back. If you know what that looks like, you got your bone and then you put something on either side of it and it stabilizes it. And I haven't felt stable like that in a long time. So that
And
was major for
what
me.
was the acronym? It's BLT.
BLT is what you're not supposed to do:
Mm-hmm.
bend, lift, and twist.
Mm-hmm.
And the twisting, I think, is the hardest thing for me to get used to doing. You're not supposed to
Mm-hmm.
twist from your waist. Now, lifting, you're probably not going to be able to do much of that anyway. And um, um, the lifting, you won't be able to,
Bending.
and the bending over forward. The brace, I'm supposed to
Mm-hmm.
keep that on whenever I'm not in bed or not in the shower. The brace has to be on, and quite frankly, it feels very very good to have it on. I also have my doctor is cutting edge, and he had a new piece of equipment that was introduced. I wasn't sure where it came from until the young man came to demonstrate. He said, "No, Dr. Miller wanted this," and so I call it my sonic belt. So it's
Mm-hmm.
I'm not exactly sure how it works, other than you put it on your waist, you turn it on, it sonics you for like 30 minutes to help
Bone.
bone fuse,
Mm-hmm.
and it's supposed to be a technique to help that to happen faster.
Mm-hmm.
So you do it every night at the same time, or every whenever at the same time. It only will work
Once a day.
once every 24 hours, and that has been interesting. So we'll see what that does. I'm anxious to see. So anything that he recommended is something that I really feel like is worth the try.
Yeah,
So
yeah. So that was pretty cool. That the Sonic. I've seen some similar things with athletes. So to help them heal quicker and get back on the field or on the court quicker. I think right
I think
now
that's kind of
we're
it.
we're good.
Mm-hmm.
Please, if you have any questions, don't hesitate to ask. Mom is willing to answer any questions about the surgery. So I see a few people have been liking the videos and things. So thank you for following along. Hopefully, it helps someone else out there that's having something very similar. I have another friend that had the almost the exact same surgery, but his was in his neck. And he's doing well as well. So he followed all the procedures and is doing everything like he's supposed to. So we will see you on the next one. Mother's Day is this weekend, so we're just going.
Happy Mother's Day.
Yeah, we're just gonna kind of hang out, and we're not gonna do too much. But happy Mother's Day to all the mothers out there, and we'll see you on the next one. All right.
Bye bye.